Edutainment Studios welcomes you to Overactive Bladder, Helping with Relief. This module is part 2 of a 3-part series on the overactive bladder. An overactive bladder causes a sudden urge to urinate. The urge may be difficult to stop, and overactive bladder may lead to the involuntary loss of urine. If you have an overactive bladder, you may feel embarrassed, isolate yourself, or limit your work and social life. The good news is that a brief evaluation can determine whether there is a specific cause for your overactive bladder symptoms. Management of overactive bladder often begins with behavioral strategies, such as fluid schedules, timed voiding, and bladder holding techniques using your pelvic floor. If these initial efforts don't help enough with your overactive bladder symptoms, medications are available. In this course, the objective is to help you learn how an overactive bladder can be treated. If you have an overactive bladder, the goal of treatment is to reduce or stop strong, sudden urges and leaks. To do this, you and your doctor will work together to make a treatment plan that may include one or more of the following. Pelvic muscle exercises called Kegels. These exercises can strengthen your pelvic and sphincter muscles. This improves your ability to hold back urine. Bladder retraining can help you hold more urine for longer periods of time. You and your doctor will make a schedule that slowly increases the amount of time between bathroom trips. Your doctor may recommend other changes to your bathroom habits, like setting a schedule for when you urinate or something called double voiding, which is emptying your bladder, waiting a few minutes, then trying to urinate again. Overactive bladder medicines work in different ways to reduce frequent urges and leaks. Some are pills, but others come as a gel or adhesive patch. They work by blocking the nerves that signal your bladder to contract too soon, or they help relax the smooth muscle that surrounds your bladder so your bladder holds more urine. If your doctor recommends a specific medication, you must take it exactly as prescribed. Most overactive bladder medicines need to be taken all the time, not just when symptoms are present. Some medication can also take a few weeks to work at its full potential. You must be made aware of this so you can let your doctor know if they are not happy with the results after an appropriate amount of time has passed. If these treatments do not work for you, your doctor can suggest other options that may help ease symptoms, including neuromodulation therapy and injections. Neuromodulation therapy helps improve how nerves that control bladder function work. Injections help bladder muscles contract less often. If none of these treatments work and you have severe symptoms, your doctor may recommend surgery. Please feel free to investigate these other sites for more information, and remember to bring any concerns or questions in to discuss with your doctor. Thank you for joining us today for part 2 of this 3-part series on the overactive bladder, and come back for part 3.